Michelle here with Plant Based Kidneys. This is a little different type of episode today. I'm going to share my personal story of why I became a renal dietitian. While I don't personally have kidney disease, I think it's important for my community to know why I'm so passionate about renal nutrition and early detection of chronic kidney disease and early prevention and progression. So, about 10 years ago, I was in my internship to become a registered dietitian, and I learned that my grandpa had chronic kidney disease and he was in stage 3. My grandma had passed away about 4 to 5 years prior, and my grandpa lived alone. My mom called me because my grandpa had gotten blood work done and his potassium levels were high. She was going up to his house to visit him, and she asked me to come up with her and was like, "We need to go through his pantry and we need to go over this handout that they gave him and figure out what he's eating that's making his potassium high." So I had had brief education on the renal diet up to this point in my schooling and some experience in the hospital setting, but I never had firsthand experience. So we went up to my grandpa's, we raided his fridge and his pantry, and of course, he wasn't eating any of the foods that he was given. This list, of course, had bananas and beans and tomatoes, avocados, nuts and seeds, and all these things he wasn't eating. He was a minimalist. He was eating, canned soups and chilies, or he was grilling a big steak for dinner, or he would just eat cheese and crackers. And so he really wasn't eating any of these foods that were on the list of foods he needed to stop eating. That way he could lower his potassium. So at this point, I wasn't even a dietitian yet, but this brief and relevant diet education that he was given is what sparked my interest. Seeing a list of healthy food be given to someone as things that they need to avoid eating was just shocking to me. It was confusing. It was also interesting and also intriguing. So I got to do a 2-week elective rotation when I was in my dietetic internship. I decided I wanted to learn more about renal nutrition. And so I did my rotation in a dialysis clinic and I loved it. It was challenging, but it was also rewarding. The dietitian in the dialysis unit played a big role in the clinic and for the patients. I also like that, it was an outpatient setting. You see the same patients multiple times a week versus just seeing them once in the hospital and then they're discharged and go home. So after I graduated from my internship, I took my test to become a dietitian. I worked in the hospital for 1 year. This is a CMS requirement that a dietitian has to work in a clinical job for 1 year prior to being able to work in the dialysis unit. So I worked exactly 1 year, and then my old internship preceptor hired me as a renal dietitian. So I was really happy at first as a dialysis dietitian. I did nutrition assessments, I reviewed patients' labs, I made recommendations on phosphate binders, protein supplements, vitamin recommendations. There was tons of lobby days and diet education and also prior authorizations to help patients get their medications. And it was a lot of work. It was rewarding. It was challenging. But in less than 6 months of working there, my first patient died. And it wasn't an expected death. It was actually a 24-year-old, and his brother went to school with my older sister, back when we were in high school. So I thought about the first time that I met with him and did a nutrition assessment. And I remember asking him, what diet education did you receive prior to starting dialysis? Because he didn't crash into dialysis. He had chronic kidney disease and he was being seen in a clinic. And he responded none to my question. He had zero diet education prior to starting dialysis. And this just baffled me because even though it was, so many years ago, he didn't receive any diet and lifestyle habit education, basically, besides when he had high potassium levels and was given information on what not to eat. So I asked the doctor in the clinic soon after, who do you refer your CKD patients to for nutrition education? And he said no one. He said he doesn't have anyone to refer them to. So of course I was like, okay, that lights the fire under my butt. I could be that dietitian to work with people with chronic kidney disease to help them, prevent or delay dialysis. So I started my private practice as a renal dietitian back in 2017, and it's grown over the years to become Plant-Based Kidneys. It's a kidney-specific food, nutrition, and cooking business to help people with kidney disease eat more plant-based foods to help slow or halt CKD progression and improve their kidney health. Food is really my passion, and renal nutrition can be challenging, but like I said before, it's so rewarding. Any renal dietitian that's working in private practice is truly committed to helping people with kidney disease. We have to do a lot of myth busting and advocating for the importance of nutrition in earlier stages of kidney disease. And we also deal with a lot of people selling a cure for kidney disease in a supplement bottle. Um, so if you've made it this far, thank you for being a part of the plant-based kidneys community. I don't personally have kidney disease, but I do have a family member who had it and went through it, and the struggles with poor diet education and high potassium levels and not really knowing what to eat that is convenient and easy, but also healthy for your kidneys. So whether you've been around for a while or you're new here, I'm happy to have you. For more recipes and freebies and kidney diet guides and blog posts, all on renal health and nutrition, you can head to my website, plantbasedkidneys.com. Sign up for my weekly newsletter, and I will see you all soon.